Let me ask you something. Have you ever noticed that your tooth barely bothers you during the day, but the moment you lay down at night, why does it get worse? At first, it starts throbbing. Then it feels deeper. Then it becomes so hard to even ignore it. And you're lying there thinking, like, why does it get worse at night? Like, it has not bothered me all day long. Today, I want to slow down and explain why tooth pain behaves this way, what it usually means, and when nighttime pain is something that you should not ignore. Because this is one of the most common reasons people end up in dental emergencies, and it doesn't come out of nowhere, right? Let's start with something simple. During the day, you're distracted. You're moving from this thing to moving to that thing, you're moving to that, you're moving, you're talking, you're busy. And so you're not really even focused on what's going on inside. At night, everything gets quiet, everything slows down, and there's no distractions. So the first reason tooth pain feels worse at night is simply awareness. Your brain has nothing else to focus on but relaxing and slowing down from you running all throughout the day. But that's really not the whole story. There's a real physical reason too. And so let's talk about the blood flow. When you lie down, blood flow to your head actually increases. Gravity is no longer pulling the blood downward. That extra blood flow increases the pressure inside of the tooth, which makes you feel a lot of the pain. And if the nerve inside of the tooth is inflamed, that pressure causes that throbbing pain that you actually feel. That's really uncomfortable, right? And that's really what happens inside of a tooth at night. Now let's talk about this inflammation. Inflammation loves stillness. During the day, movement helps with your circulation, so it's pumping all throughout your body. But at night, like I said earlier, everything slows down. Inflammation becomes more noticeable. If the tooth has deep decay, a crack, or even an infection, that nerve becomes irritated and agitated, and it's going to let you know. That irritation doesn't shut off at bedtime. In fact, it often becomes louder. Louder with the throbbing. Now, let's talk about this clenching and grinding thing, right?
Yeah.
This is a big one. Many people grind and clench their teeth at night without even realizing it. Stress, anxiety, and fatigue all increase your grinding. When you clench, you put an enormous amount of pressure on your teeth. Hey, what's up, man? That pressure irritates the nerve and the ligament around the tooth. So that pain you feel at night may not be coming from the decay alone. It may be coming from the overload to that particular area. Let me give you a picture. Think of a sore muscle. So you've been lifting weights all day. During the day, you're using it, it stays loose. But at night, that muscle, or even when you wake up, that muscle tightens up. And teeth experience something similar when grinding is involved. It's just constantly just pushing and pushing and pinching and clenching and clenching. Now, let's talk about the temperature. At night, people often drink cold water and breathe cooler air. Teeth with sensitivity reacts more strongly at night. And when the nerve is already irritated, now here's something important. Tooth pain that wakes you up at night is a red flag. I ain't got nothing else to say about it. It's a red flag. Nighttime pain that wakes you up, keeps you from sleeping, or throbs constantly is often pointing to the nerve involvement. That could mean deep decay, pulp inflammation, or even infection. Now, this is where people start saying it's unbearable. And it's typically at night. But they're okay during the day. And that pattern really matters. Let me tell you about a patient. Okay, let me see what his name was. Okay, his name is not important. He said to me, it only hurts at night. So I thought I could just wait. By the time he came in, the infection had progressed so far that he needed more treatment than he would have needed earlier had he just come in. Nighttime pain is often the tooth's last loud signal before it just gets all the way bad. Now, let's talk about relief. We've talked about all the other things. Let's talk about relief. People ask, what can I do tonight? The first thing is probably getting you some over-the-counter pain medication. This medication is going to actually reduce the inflammation, and you're going to also try to avoid laying down flat. Elevate your head slightly and avoid chewing on that side. Now, you also want to avoid hot foods or very cold foods. These may help temporarily, but here's the part I need you to hear. Relief doesn't mean resolution. If the tooth pain keeps returning at night, the problem is still there. It's not going away. The pain that comes and goes can become pain that stays for a long time. Now, let's answer this emergency question. Is tooth pain at night an emergency? Now, it depends. It becomes urgent if you notice some swelling, fever, facial pressure, difficulty swallowing, or pain that keeps getting worse quickly. Those are the signs that suggest infection. Night pain without swelling is often an immediate emergency, but it should be evaluated very soon, within a day or two, max. Early evaluation often prevents a bigger chance for something deeper in the procedure. Now, parents, I want to talk to y'all too, because there's kids too. Kids may wake up at night with tooth pain and cannot necessarily explain it clearly. I want you to pay attention to the patterns. Night pain in children is something that we shouldn't ignore. Let me say something very, very important. Tooth pain at night doesn't mean you've completely failed with your child, but it does mean that you can't ignore what's going on. It means inflammation has reached a point where the body can no longer ignore it, and pain is not the punishment. It's communication. It's your body telling you something's going on. And nighttime pain is your body's asking for help louder than before. Let me leave you with this. If tooth pain gets worse at night, you got to listen to it. Don't panic, but don't ignore it. Early care protects your options. If you wait, it narrows the options that you'll have. Your sleep matters, your health matters, and you deserve relief, not fear. It's been an honor. Appreciate your attention. Y'all be blessed. Talk to you real soon.